thanks very much for your time, first of all. If you could just talk to me about how things have changed with regard to patient control over the 30 years you've worked in the services.
Okay. There's a whole variety of ways in which control for patients has changed. When I started in the NHS, I started in mental health services, where at that time I was responsible for a hospital of 1,500 people. They were dragooned into there, they were organised in a particular way, regimented in the way that they were treated. The services that we have today, people wouldn't recognise them. They are absolutely remarkable. When you think about the way in which mental health services give people much more power and control over their own affairs, whether it be through their own personal affairs or whether it's through the treatments and the education and training that they have, it's all very, very different. But we're not gone far enough. We've a lot more to do. And a big area for me in terms of patient control is in people with long-term conditions. One of the things that all the evidence shows is that people with long-term conditions, if they give them more control and more power, not only does their own health improve, but also you get better value for taxpayers' money. It actually costs less money if they're involved in that. So I think it's a really big area for us to focus our attention on in the future.
Brilliant, okay. And do you think there's going to be too much pressure on GPs? Do you think it's almost too much heading their way?
No, not really. I think GPs are the kind of navigators and gatekeepers for patients. And in lots of ways, they spend a lot of time trying to navigate a system which is almost incomprehensible for some patients. And I think simplifying the system in the way we do and getting GPs to help us simplify it will make their jobs much easier rather than more difficult.
Brilliant. And then just very, very last thing, you've seen NHS Local, what did you think of it?
Yeah, I think it's fantastic, and this sort of thing, it seems to me, is absolutely the way we communicate with our patients and with the population needs to take a great leap forward, and using these kind of media to me is very, very important for the NHS in the future.
Thank you. Thanks very much.